Center for Bioethics and Medical Humanity atau CBMH merupakan bagian dari Fakultas Kedokteran, Kesehatan Masyarakat dan Keperawatan Universitas Gadjah Mada. Sebagai bagian dari perguruan tinggi ini, kami mengemban tanggung jawab untuk melaksanakan Tridharma perguruan tinggi. Kolaborasi nasional dan internasional merupakan kunci dalam melaksanakan Tridharma tersebut. Melalui kolaborasi ini pula, CBMH dapat bertransformasi menjadi sebuah pusat pengembangan ilmu bioetika dan humaniora kedokteran dan membidani lahirnya program Master Bioetika.
Good afternoon, all participants of Rabawan discussion, bioethics discussion today. Good afternoon to our
Good afternoon.
Indonesia and also from Malaysia, and welcome to our distinguished speakers, Dr. Navi Chabra, Dr. Siva Kumar Arunachalam, and Dr. Kirti Saxena. Thank you for the opportunity for us to have this collaboration and to listen and learn today about a very fresh topic that is about empowering elderly, fresh insight into aging and geriatric dentistry. It's a very important topic and also interesting, as it is also a rare opportunity for us to discuss, especially about this elderly population and what it means of related to aging and how it is related to geriatric dentistry and also the ethical issues related. So allow me, Agnes Pratiwi, today to be the moderator of the session. I'm a PhD student. I'm doing my research in primary care ethics, and I'm also myself a dentist. And without further ado, allow me to introduce our first speaker, Dr. Navi Chabra. Dr. Naveen has completed his Bachelor Dental Science from India Manipal Academy of Higher Education, and then also he is a master and with a specialist in conservative dentistry from Rajiv Gandhi University, India. He is currently a full-time academician and specialist endodontist. And his area of expertise is non-surgical endodontic treatment, how to retreat failed endodontic cases, and also root canal disinfection and dental restorative procedures. He is author of several national and also international scientific publications, and he is also a peer reviewer in scientific journals. He has delivered, I believe, many lectures and workshops about conservative dentistry and endodontics. And he is also the lead or co-lead for several community engagement, social welfare, fundraising events to support underprivileged society and also adults with special needs. So please welcome Dr. Naveen, and the floor is yours. Still muted, doctor.
Thank you
Yes.
so much, Miss Agnes, for your kind introduction. Am I audible? I can hear some echo. Is my voice clear to you?
Yes, very clear.
Okay, thank you so much for your confirmation. So first of all, shall I share my screen? I think.
Is it possible to full screen, Doctor?
Yeah.
And yeah. Thank you.
Okay. So is it clearly visible, and I'm clearly audible as well?
Yes,
Okay.
very clear.
Okay. So thank you very much once again, Miss Agnes, for your kind introduction. And also, I would like to thank Center of Bioethics and Medical Humanities, Faculty of Medicine, Public Health and Nursing, University of Gajah Mada, in Reborn collaboration with the International Medical University, Department of Bioethics and Medical Humanities, Kuala Lumpur, Malaysia, for giving us the platform and opportunity to represent our school as well as the university at your reputed university and the platform. So as you can see in the first slide, the topic for the uh, presentation is empowering elderly. Okay. So as Ms. Agnes, you rightly said that it is a very, very important topic, and we should uh, have great insight about this, because uh, elderly are the one of the most important people of our society who has uh, grown up and aged, bringing ourselves to the new world. Okay. So with this, I would like to begin my presentation with your kind permission. Okay. So let's talk about the fresh insights into aging and geriatric dentistry. So I myself, Dr. Naveen, from School of Dentistry, along with my colleagues, Dr. Siva Kumar Arunachalam and Dr. Kirti Saxena, will be taking this opportunity to speak before you or share our knowledge regarding the geriatric dental care, uh, where I'll be talking in brief about what is the need of geriatric dental care, and Dr. Siva will be continuing the same topic, stressing upon the need for empathy, sympathy, and compassion. Thereafter, the topic will be led by Dr. Kirti, uh, who will be discussing about the interprofessional collaboration and importance of interprofessional education in geriatric care. How does it implement it, and how will it uh, contribute to the betterment of the geriatric society? So this is a brief introduction about the topic. To begin with, to care for those who once cared for us is one of the highest honors, and it becomes our utmost priority and the duty to look into the geriatric population on a serious note. Okay, so with this thing, I would like to start geriatric dental care need of the hour. It's a well-known fact that our geriatric society across the world is aging. What is this? What is the primary reason for that aging process? It's primarily because of the better life expectancy, that is because of the fantastic healthcare and the medical facilities around us available to all across the countries, especially the developed countries. Also, the raised awareness of the maintaining good oral hygiene has led to the increasing number of natural dentition uh, in the older population. That is why this topic becomes very, very important, that we have to seriously stress upon the geriatric dental health care. Okay. Now, when we talk about the term elderly, what do you mean by elderly? Elderly is currently classified under the three headings: the early elderly, the mid elderly, and the oldest old elderly. So early elderly definition is 65 to 74 years of age. The mid elderly population ranges from 75 to 84 years of age, and the oldest old are 85 years or above. So you can clearly see in this flow diagram that the life expectancy of the geriatric population is substantially higher. Where we used to consider 60 as a retirement age, now it has so now elderly starts at 65. So we need to consider this point in holistic way. Okay. So as I discussed in the first slide, that world population is aging. Similar way, Indonesia and Malaysia are not different in the same context as well. And according to the recent census report, the Indonesia and Malaysia both are expected to become the aged countries by 2035. What do you mean by that thing? It means that by 2035, that Malaysia will be having more than 15% of the population above 65 years of age. That is what the criteria is all about. And this population is going to increase by 2055 or to 56 by 3 times. So it gives us the essential need that we should create a workforce that specially caters the need of geriatric patients, especially in regard to the dentistry, because in the current scenario, even in the after so much of educational awareness, and in the current scenario, still the developing nations like us require special attention for this thing, because dental health is still underprivileged, is not affordable to everyone right now. Okay, so that is why we need to create a task force that effectively delivers the dental health care to geriatric patients. Now, why geriatric patients are difficult and different from common population? Most of the geriatric patients are associated with the various debilitating diseases, various neurophysiological changes in their body, as well as the oral physiological changes in the body because of the aging process. Apart from that, they also at times suffer from various mental situations that may be because of multiple reasons. For example, one may be the neglect by the society or social isolation, maybe has been found to be one of the very, very important and crucial factor in that thing. Now, let's discuss about the factors that influence the older people's utilization of dental services. These can be categorized under the various headings like illness and health-related factors, socio-demographic factors, service-related factors, and attitudinal or subjective factors. If we talk about the illness and health-related factors, as I discussed earlier, the debilitating diseases, oral changes, or the neuropsychological changes, all those combined affect the oral health status, and a patient may have some sort of illness, it can be systemic or the local illness, or some discomfort, or patient may have the limitation of the functional movement because of the some disabilities. Similar way, the social demographic factors may include like place of residence, like for example, the patient may reside far away from the dental healthcare facility, or patient is not educated enough to have the awareness about the dental health, or the income of the patient or the family does not allow to seek the dental health care, because dental health care still it is considered to be one of the expensive aspect of the medical health care. Similar way, age, gender, culture, and ethnicity also play a crucial role at times, especially in the developing nations. This is very, very prominent. If we talk about the service-related factors or the other attitudinal or subjective factors, the dentist behavior or the healthcare professional behavior, the dentist attitude, the cost of service, satisfaction with service, and the availability of transport and the accessibility to the dental healthcare facility also plays a major role. Apart from these, some patient may be fearful and anxious about the seeking of dental health care because of various personal beliefs. What do I mean by these personal beliefs? we also might have encountered, at least as a dentist, I have encountered this kind of statements several times. Like some patient will come to you and say, doctor, if I get my tooth removed, will it affect my eyesight? Or some patient may come, doctor, if I get my teeth cleaned, will my teeth will become mobile? Because it has been told to them by their colleagues or the friends or maybe some other experience they have encountered, which is actually a personal belief and actually does not happen. So we need to spread the awareness to the people that it it is just a myth. It is not a thing. So we have to break that myth. So these are the factors that affect the delivery of dental service to such older populations. And if I talk about the mental factors, the older patients are very at times very difficult to make them convinced that regarding the dental treatment. However, if we carefully deal with those patients, especially as when we talk with them with the compassion or the you utilizing the proper empathy, then probably they do get convinced. In my personal experience, majority of the older patients are very cooperative. Only thing they require us the special attention from us. Now let us talk about the how does the nutrition and the old age related. Various nutritional deficiencies or the disorders at times may relate will aggravate the physical and the mental degeneration, especially in the older populations. What do I mean by nutritional deficiency? For example, some protein deficiency or the calcium and the phosphorus deficiency or the some essential minerals and vitamin deficiencies. These can cause uh, in a, inadequate nutrition to the body, leading to the accelerated physical and mental degeneration. Okay, one of the very important factor that that contributes to the nutritional deficiency, especially in the aged population, is poor eating habits, either or it may be because of the disorder of the oral cavity. For example, the teeth are missing. Patient has not got the proper teeth, either or the patient has deep cavities or the caries in his or her teeth, and patient cannot chew properly or the teeth are missing, so patient doesn't wear the denture. So ultimately it is affecting the dietary habits or the eating habits. So patient neglect those things, and uh, unfortunately they undergo uh, accelerated physical and mental degeneration. Okay, so what all changes apart from this which happen in the oral cavity, as we have been discussing till now, that various age related changes happen in the geriatric patients, but what specific to the oral cavity that makes the situation alarming, and that is why we are sitting here and discussing here why geriatric healthcare or the geriatric dental healthcare is important. Most important factor is changes in the salivary gland. We all know salivary glands secrete the saliva. So saliva keeps our mouth wet. However, because of the aging process, salivary glands usually undergo fibrotic changes, which leads to the dryness of the mouth. So when the mouth or our oral cavity is dry, the patient's defense mechanism to fight with a carious microorganism is reduced. So ultimately, it increases the uh, caries progression, the heart tissue, dental heart tissue. Caries, I mean to say, if those who do not understand the term, the scientific term, the cavitation or the cavities in the teeth. Okay. Apart from salivary gland, if we talk about the oral mucous membrane, the inner lining of the oral cavity, that also becomes thin and friable, which is more susceptible to various pathological conditions, because microorganism can invade inside and cause the local infections. Okay. Similar way, in the dental heart tissue, because the wearing process, enamel thickness, which is the outermost covering of the tooth, will get reduced, which in scientific language we call it this process as atresion or wear out. Okay, so with enamel is actually getting reduced to compensate that the dentine which resides below the enamel gets thickened, or we call it as sclerosis. But dentine sclerosis has it's actually a defense mechanism, but it leads to at times the negative effect also, causing the pulpal atrophy. The pulp is the actual vital tissue of the tooth, which is the alive tissue, which becomes fibrosed or sclerosed because of the aging process, leading to the blockage of the canals. At times, as an endodontist, I encounter very multiple situations such kind this, which allow us to, which does not allow us to create the proper path for the root canal treatment. Okay, so similar way, the aging majorly affects the periodontal disease. This periodontal disease, I talk, this is very common in geriatric patients. It may be because it is related to multi factors. One factor we already discussed, the nutritional deficiency. Apart from nutritional deficiency, various systemic diseases. Most common systemic disease may be the diabetes or the sugar, which is very common in our Asiatic populations. Okay, which usually leads to the reduced thickness of the bone or the weakened bone support, leading to the tooth mobility. So tooth becomes mobile, they ultimately shed at times, or the patient is not able to properly follow the dietary habits. Okay, which further leads to the other systemic problems. So what are the challenges to overcome through which we can make the geriatric population a better world as far as the dentistry is concerned? Deciding the treatment plan and determining the prognosis are majorly influenced by various systemic and local factors as discussed now, as well as the person's previous experience with the dental treatment. At times, especially the geriatric patients are very much fearful and anxious about the past experience if they did not have the satisfactory dental experience earlier, so they'll be majorly reluctant to receive further treatment. Despite dental conditions affecting the elderly being treatable or preventable, many of the elderly patients do not avail the dental treatment. One factor I already discussed. Apart from that, another very important factor is that the population which is currently in 60s or 65s or 70s, they were never introduced to the concept of preventive dentistry at the younger age, because at that point of time, maybe 20, 30 years ago, the prevention or the preventive care was not prominent even for the educated population. If we forget about the less educated or the lower people from lower socioeconomic strata. So many still, apart from this, many still hold the opinion that tooth loss is a normal part of aging process, because they have seen their inner families, their grandparents or their fathers, they have lost the teeth. They were on the liquid diet at times, or some of them had worn the dentures. So they have a very common belief that teeth is going to lose. They don't realize that teeth can be saved, and until we are live, we are living. Okay, even there are patients who have the natural dentition uh, at the age of 90 years or so. I personally, in my family, my grandmother at the age of 90 years had her natural teeth still intact. So it depends on how well you maintain and how good you maintain the oral hygiene. Okay. So the most important factor, as I discussed earlier, for elderly is we have to put ourselves in their shoes. We have to connect with them emotionally. We have to talk to them. We have to feel their what they expect from us, and we have to be very compassionate. We have to be empathetic. So this is very important and crucial aspect. I would say it is not about the dentistry; it's about the overall geriatric healthcare, because dentistry may be an important part for us, but for elderly, overall empathetic care and the compassionate care is very important. Okay, so Dr. Siva will be talking about in detail about the empathetic and compassionate care in the forthcoming presentation. So as of now, what next? How can we deal with this? So we need to incorporate a design of or a dental curriculum that needs to highlight special focus to geriatric care. If some of you are there from the dental fraternity, definitely they might have studied specific dedicated geriatric chapters in few subjects like prosthodontics, or at times we in endodontics, we also have the geriatric endodontics dedicated chapter. Apart from that, few other like periodontics. But in general, overall, if we say geriatric, special dedicated focus of dental curriculum towards the geriatric healthcare, dental healthcare is still missing. So we need to find a link that connects well, and where we can adopt in future the ideal undergraduate dental curriculum that caters the need of geriatric patients. So interprofessional education experiences will better prepare the graduates for future dental workforce. What do we mean by interprofessional education? Interprofessional education basically means where we team team up with a multidisciplinary approach, where the people from different specialties, not only the dentistry, but apart from dentistry, there are uh, uh, medical people, there are chiropractors or the physiotherapists who can, there are speech therapists, there are hygienists, there may be psychologists who assess the thing, there may be nursing fraternity. So we need to develop a team and deliver the individualized rehabilitation in creative collaboration with as a teamwork, which will definitely influence and overcome all the challenges which we have discussed till now, and we will be able to deliver the successful and quality dental treatment to the most needy elderly patients. Okay, so with this, I would like to conclude my presentation with a quote: remain patient and give all your respect and dedicated care to elderly. They have earned their dignity through their lifetimes. Thank you very much. So I would like to pass on the podium to Dr. Siva for his insights about the empathy and compassion. So here are the few reading slide references you can refer. Okay. Thank you so much.
Thank you so much, Dr. Naveen, for your presentation. It's very interesting to know that because of these physical and mental challenges, the elderly need special attention. And they are also sometimes fearful and anxious to access care related to their dental health, which is also why we will just in a minute listen to the next presentation, which is about empathy in geriatric dental care. So we will have the presentation from the three of our speakers today, and then we will have around 30 or 20 minutes of discussion afterwards, if that will be all right. Allow me to introduce our second speaker, Dr. Sivakumar Arunachalam. Dr. Sivakumar, welcome again, and thank you for this opportunity for us, Center for Bioethics and Medical Humanities, to have you from the International Medical University, Malaysia. So Dr. Sivakumar completed his Bachelor Dental Science from Tamil Nadu Medical University in India. And then he is an orthodontics from the College of Dental Science, Manipal, India. He is currently Associate Dean at the IMU School of Dentistry and clinician in charge for Oral Health Center. He is also fellow of the Royal College of Surgeons, Edinburgh, United Kingdom. He is recipient of the John Simpson Trophy for Excellence in Teaching 2021, also winner of the first prize of Excellence in Teaching, International Medical University 2021, and also winner of E-Learning Innovation Competition, IMU 2022. So many awards from Dr. Sivakumar, and he has also published many scientific papers nationally and internationally, and also 2 textbooks. So without further ado, please welcome Dr. Sivakumar, and floor is yours.
Thank you, Dr. Agnes. Thank you for the wonderful introduction, and thank you, Dr. Naveen, for the wonderful presentation and taking the lead. And thank you for the entire forum. And it seems to be a very fantastic collaboration between different universities and especially the UNESCO chair, UGM. And moving forward, as we listen to Dr. Naveen's talk about geriatric dental care, I think I'm going to touch one of the very important aspect, especially when elderly people are concerned, right? And it's nothing but a very subtle phenomenon, you can say, which is called empathy. And we get to see this term very often. I mean, in an academic life, university life, we get to see with students, the first thing we ask them is, especially during their assessment or during day-to-day clinical rotations, we notice that how empathy is being delivered and, reciprocated. So in that context, probably when we look into elderly people dental care, I think this is one of the important attributes which every one of us really need to focus on, so that as Dr. Naveen mentioned in his last slide about dignity for geriatric or elderly people, I think it connects very well to that concept. So you can see I'm Dr. Siva. I think no more introduction Dr. Agnes has given very elaborate and thoughtfully. Now, this particular Mark Twain's comment, wrinkles should merely indicate where smiles have been, right? Now, this might be related to emphasizing the fact that understanding, accepting, and valuing the life experiences. I mean, they can be related to empathy and how it relates to old people, especially filled with moments of happiness and connection, rather than just a mere sign of aging, right? We always look, elderly people, they are aged people, right? But beyond that, there are a lot of hidden things sometimes we overlook or we take it for granted. So that's where I'm trying to put in perspective what all areas we can stress so that we don't miss out on very important features or characteristics, as well as how our students actually respect and take that value further forward. Like, let's jump on to into the presentation now. So what I'm going to cover in this in this presentation, probably I just put it succinctly here, the attributes of empathy, like, whether we can define this empathy and what extent we can define, and also the importance of empathy in geriatric dental care, and also strategies to exhibit empathy. So some would think that whether this particular behavior, is it possible to coach or teach someone, or is it something automatic? So we'll get to that point during this presentation. And also a simple case study, how the empathy can be delivered in a dental team and the challenges what we face or any healthcare personnel could face. And finally, empathy as human value in life. An informal study with IMU dental student, I would like to share this data, and it's quite interesting to know what they perceive, and probably there will be cultural differences, and different parts of the world will have different notions about this. Let's see what's around here, around this part of the world, right? Okay, moving forward. These terms, sympathy, empathy, compassion, they're quite interrelated, isn't it? So oftentimes we get confused with using these words, or we use many times, sometimes we don't know the exact meaning of these particular words. But both sympathy and compassion are reactive responses, unlike empathy. Like sympathy, you can say it's a pity-based, like, when you see, this is happening to him, something like that. It's not empathy. Sympathy is pity-based and kind of a sorrowful response towards the misfortune of another person, which empathy is not. Empathy is totally a different science and behavior, where you relate that particular concept or the phenomenon, how the thing is attached to the another person. So how you see the other person in his own shoes, or you can put it that way. So that is empathy. How you relate to the other person. A person is suffering, but how much you can relate to that suffering. So that is empathy. Compassion is something which is overarching, actually. It includes empathy, to be mindful of one's dignity and, respect as well. That is compassion. So all these three things are important in healthcare, and more so for geriatric dental care or geriatric medical care, you could say. So this point, this slide tells about the different attributes of empathy. As you can note here, there are few. I mean, it's quite a prevalent mechanism that some would argue, especially the healthcare personnel would say, what we are looking is a cognitive empathy, because sometimes doctors need to take some rational decisions or rational perspective. In that sense, they say cognitive empathy is very important. Cognitive empathy is a conscious process, unlike emotional empathy, which is automatic. Like sharing an emotional experience with their fellow person, fellow colleague, or even with the patient. Or sometimes we get affected by others' feelings, right, at that point of time. And also feeling distress in response to someone's plight. So those attributes, they actually align to kind of behavioral empathy, you can say, which is emotional empathy. Unlike cognitive empathy, which is nothing but taking another person's perspective. You live to the other person's, notion, or imagining what it's like in another person's shoes, or able to understand someone's thoughts and feelings. You're able to understand. So it's quite a lighter version, but slightly very rational thoughts can be put into the process. But probably when I look into this aspect, two things, I think we need a balance of both, actually. Just not cognitive empathy alone in our care, especially with geriatric population, but some amount of emotional empathy is also required, and which can be taught, which can be coached, and which can be shared with others, and especially with the current generation, so that they take on forward. Coming to empathy as such, now this is one of famous orator, Brené Brown. So she says empathy has no script. There is no right way or wrong way to do it. It is simply listening. So very important. Simply listening, holding space, withholding judgment, emotionally connecting, and communicating that incredibly healing message of you're not alone. So this is the core idea of empathizing with someone, and especially we are talking about geriatric care here. I mean, all these attributes: listening, you don't make any judgment, or connecting with them, and that ultimately you will have a proper communication, right? So I think this particular statement, which aptly describes empathy in a wholer sense. And probably if you can teach our generation, our generation and the younger generations, I think it's a way forward. So I'm going to play a small video here. Can I do that? Yes. Hope you can.
And why
is it audible?
Sympathy. Empathy
Yes.
fuels connection. Sympathy drives disconnection.
So it's a 2 minutes video. Just carefully listen. I think a lot of wonderful points are there.
Studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, uh-huh. No. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." Yeah. And we do it all the time because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay, so that's about, I think she used certain, I think it describes everything. And this is one of the, one video or, interesting piece of information I think we should share to our colleagues, workplace, and even to our kids and everyone, which clearly describes, especially those sacred space and silver lining. I think very important. So coming back to the topic, so these two qualities are definitely very essential qualities when caring for geriatric dental patients, as they can greatly impact the patient's experience, overall well-being, not just the overall well-being, even the quality of life, right? We are looking at the quality of life, and it starts with empathizing and delivering these attributes. Not only just taking care includes everything, not just the treatment alone, but how you deal with that process. So, okay. Some of the critical parameters, what we are looking here is how do we address that? Like, for example, enhance patient comfort. So probably we need to be creating a supportive and understanding environment, and also improve communication. So when we deal with geriatric patients, these are the important things. Like, you need to establish a better patient elderly interaction or communication, you would say, and trust their recommendation. I mean, you need to the elderly needs to trust your recommendation, right? So that enhanced trust important, and respect for dignity. I mean, again, I told you it cannot be taken for granted, and you need to respect for their dignity and independence highly. So that is more important. We might think, okay, they're quiet and frail, and sometimes, but they've had their life experiences, and they have their own dignity and independent attitude, so that we need to respect. So these are some of the things. I'm not going to go into every detail, especially the one tailored treatment here, right? So when it comes to the clinician, probably this is also very important. Their needs are different. So we need to focus on that as well, and also fostering long-term relationship. So this is, again, this second slide, I'm going to tell how we can execute this, and also what are the critical parameters we could actually follow it up. Sorry, my slide is going a little slow. Okay. So strategies here, like how to, for the dental professionals to exhibit empathy, right? Some of the techniques which has been time tested and also has proven valuable in the course of care, as well as demonstration to the patient, students as well. So the one and foremost important is active listening. So active listening is a very important parameter. So when we deal with the geriatric patients, that's very important, and also asking simple open-ended questions. So open-ended questions matters. So these characteristics or these techniques are going to be different from how we are dealing with maybe a child patient or an adolescent patient or other normal population, right? So it's quite unique, and we need to understand, okay, listening is important. We don't talk, everything talking just because we are on that platform, but active listening is very important. What they might be very slow and take time. So patience is very important from our side to understand them. And empathetic non-verbal communication. Non-verbal communication is very important. And sometimes our voice and how we, stand beside them, just a small gentle tap, gentle, touch, probably that helps a lot to exhibit these characteristics. And of course, comforting language. Patience, as I noted, patience very important. So the one who cannot do this activity, I mean, requires time in the workplace. Probably that's the culture we need to develop to have patience when dealing with such patients and to establish their trust. And customized care plans we saw, build trust over time, follow-up and checks. So they are prone for many follow-ups and check-ins. Probably we need to accommodate these parameters so that we can have a very productive engagement with the elderly. So these are the strategies. Let's see a simple case study. So Daniel here is a 75-year-old man. So you can see at that age, even our parents or grandparents, we must have experienced ourselves, right? So when we see such patients as well, especially living with dementia, Alzheimer's disease, obviously they have that anxiety factor or agitation for these unfamiliar environments, especially dental environment. You could see like the dental chair with the drills, everything. So it's quite sometimes not an easy place for them to be wandering, right? So we as a practitioner or as a dental students, probably we need to be mindful of that and try to negotiate to win their trust as well as the cooperation and the understanding. So this particular person, Daniel's family, struggled to find a dental care provider willing to accommodate Daniel, unique needs. Eventually, they found a dentist who specialized in geriatric care and had experience with patients like Daniel. So geriatric care in a part of the world, probably even in Malaysia, this particular curriculum is stepping up. So soon we'll have a separate module with geriatric dental education or geriatric education. So there are centers where some of the healthcare professionals, they are actually specialized in geriatric care. So his family, they wanted to have this service, right? So during Daniel's appointments, the dental team went to great lengths to create a calm and familiar atmosphere. This is very important. And the team has to perceive that, the patient is in a state where he needs special attention. So they allowed to bring his favorite music, use soothing lighting, and also provide a warm blanket to comfort. Sometimes our centers are quite chilly with a lot of the temperature below 16 degrees, and sometimes we need to be mindful of small, simple things which may not be tolerated by elderly, right? So the small things the team is addressing. And the dentist and staff communicated patiently even when Daniel began disoriented, a little bit of disorientation. So what ultimately happened over time, Daniel's dental health improved, but more importantly, his dental visits became less stressful for him and his family. So that's the outcome we are getting. So to get that outcome, we need a very strong commitment as a healthcare professional. From our part, it's just not one person. The whole team is acting and doing that service. So empathy and sympathy displayed by the dental team not only benefited his own, but also his oral health, but also improved his overall well-being. I would say oral health related quality of life, or quality of life as such, right? So the challenges, especially, we know that, some of the things I think Dr. Naveen also mentioned, communication barrier or physical health status, they can be debilitated in certain, they might be coming for a particular dental care, but systemically they will be affected with other issues. And another important thing, communication barrier, they may not be able to listen to you clearly, or they take time to, understand or even negotiate whatever you're telling. Anxiety, of course, we saw, and complex dental needs will be there. It's just not one problem. They'll have multiple problems. Sometimes some are without teeth for a long time and the bone is a little narrow, and you have other teeth complaints. Sometimes teeth are mobile, they're loose. So multiple problems you need to attend at the same time. And limited financial resources, this is also a concern. And it's a major concern for elderly people. Of course, family is supporting, but still to meet the demands, the concern is a quite grave situation. And loneliness and isolation, sometimes they do feel that loneliness and isolation, especially if they don't have the partner and things like that. There are many other things which are happening around them. So we need to be mindful of that as well. And the cognitive decline, this is quite evident, as we all know, they'll add this. So we need to be very patient. That's why, and time constraint and cultural sensitivity and balancing both technical and emotional care. So technical care from our part, we need to be, just should not be off to only one aspect of care. Emotional care, especially what we're talking is empathy here. So the final thing, what I'm going to show here is there's a small survey where the dental students participated 3 cohorts, especially year 5, year 4, year 3. There's no comparison. It's still on progress, and 94 participants actually participated. And we, as Dr. Kirti will be explaining in interprofessional education, how we deal with multiple disciplines come together in our clinical floor. Especially dealing with geriatric dental patients. So some of the questions that was asked in the survey. Okay, it's about awareness of empathy as human value in life. This is a core concept. So now the questions asked, have you heard about or read about empathy during your primary or secondary school days or even earlier? I think almost all, most of them, 81%, 81 people, that is 86% of the sample, they address yes. Do you believe empathy is essential to human life? Predominantly majority. What is your belief about the possible relationship between empathy and mental well-being? Again, 63%, they said definitely related. I think some would say somewhat related, something like that. So it's a kind of, they're trying to explore, what they think about empathy. And another important question is, nowadays, in your experience, how easy or difficult it is to follow or observe these empathy in one's day-to-day life. So I think surprisingly good answer actually here, 66% saying fairly easy. So they are tuned to that, the current generation, what we are seeing, right? And another important thing, my older patients feel better when I understand their feelings. 94% say that, yes, they could feel that. And I believe empathy is an important therapeutic factor in dental treatment, right? Again, you get 100% result. I think it's tagged to the dental treatment. So technical treatment is not different from the emotional aspect of care. Another question was, an important component of the relationship with my elderly patients is my understanding of their emotional status as well as of their families. Again, predominantly they agree to that. And it's a therapeutic skill without which success in treatment is limited. So it shows, the survey shows that empathy is a core thing and also very important as part of their training, as part of developing their skills. Even though we might say communication or presentation is kind of soft skill, I think I would say empathy is something softer than soft skill, which needs to be really taken at that level so that your treatment can be very successful, isn't it? So one of the things, last one I can say, because attentiveness to my elderly patients' personal experience does not influence treatment outcome. So here they say, you want to check whether how far their emotional thing is influencing their treatment care, right? So that also they're able to appreciate that. Maybe when we analyze the data, still more, this is kind of questionnaire. So if we have a focus group discussion or if we thoroughly do a qualitative analysis, I think we'll get a better version of this particular assessment. Yeah, moving forward. Can you move the slide again? Yeah, thank you. So my understanding of how my elderly patients and their families feel does not influence by dental treatment. They could align to that. And because people are different, it is difficult for me to see things from my patient's perspective. So it's kind of a mixed answer here. So probably they are thinking in their, thought process, whether, what kind of temperament they do have. Is it really influencing their thought process? Something like that. Okay. I leave it to their judgment actually for the students to, when we put that, then they realize, okay, what all things happen in their mind. I think it's a good way to start with exposing the empathy and teaching them about empathy. So one of the famous quote, the good dentist treats the patient's concern, the great dentist treats the patient who has the concerns. So that's what we need to know as a practitioner. Next slide, please. So last but one, some of the studies, we see a lot of investigations in empathy in medical field, medical students, but less so in dental students. But I would say not just because we're dentists, but empathy is very important because we deal with a lot of elderly people who needs that care, and we can appreciate that how anxious and with that commitment they come to our clinic, and how the students deal with them. Once they are comfortable, you see a whole lot of difference in their face and in their language, as well as how they come for next time, because dental care again repeatedly they need to come, right? So first time experience matters a lot. So that's where they can tap on these potential, the students learning about empathy as well. So this, I think we saw perspective taking, compassion care. Brenny Brown has explained very clearly. Last one, please. Okay, I would leave it, with this particular quote. Here it says, unlike compassion or sympathy, it is not automatic. It requires effort to really master the art of empathizing with another person. And I think we can feel the difficulty sometimes, even with our fellow same age, related people, but it's more so for elderly. So it's very important for the current generation, for the student population. We deliver this, and we also make them really aware of these principle associated with empathy, so that they really know about, like the statement says, you never really understand a person until you consider things from his point of view, until you climb into his skin and walk around in it. Thank you so much.
Thank you, Dr. Siva.
Thank you.
Nice presentation. It's really interesting to know that the dental students believe that empathy is an important therapeutic factor. But when you ask them, what about seeing things from the patient's perspective, then you get a mixed answer.
Yeah.
So it's
Yeah.
really interesting. Thank you for this presentation, Doctor. Now allow me to move to our last but not least speaker. Thank you and welcome, Dr. Kirti Saxena. Maybe you could have around 30 minutes or maybe a bit less, and then after that we can have a nice discussion about all the presentations. And allow me to introduce Dr. Kirti. She graduates from the Dental Science RGUHS in India 2009, and she is a specialist orthodontics and dentofacial orthopedics, also from India. And then she is also part of MFDS by the Royal College of Physician and Surgeon of Glasgow in 2020. She has 12 years of clinical experience in enhancing the smiles of patients of various ages through orthodontics. She has also 8 years of academic experience teaching undergraduate as well as dental surgery assistants. She has various awards, the secured silver awards in the International Learning Resources, and also winner of the 3rd prize for excellence in teaching from IMU 2023. She is also author and reviewer of scientific journals, and she leads also various research projects and has an interest in education. Welcome, Dr. Kirti. And we are lucky that she will today explain to us about the importance of professional collaboration in dentistry. Please, Dr. Kirti, floor is yours.
Thank you, Ms. Agnes, for the kind introduction. I'd take a 1-minute opportunity to thank the team of Bioethics and Medical Humanities, University Gajah Mada, and of course, my own International Medical University for giving me this opportunity to speak at this forum. So not wasting much time, let me just share my screen. Okay, is my screen visible?
Yes, it's clear.
Okay, so today I'm going to be talking about interprofessional collaboration in the geriatric dental healthcare and all the things that it consists of, all the benefits that it offers us, and the benefits to not only the team, but also to the patients will be discussed. All right, so let's get started. So individual commitment to a group effort, that is what makes a team work, a company work, a society work, a civilization work. These are words of a famous or the greatest coach in American football history, Mr. Vince Lombardi. And this is what is the crux of interprofessional collaboration for geriatric dental care, because it is the individual commitment to a group effort. Individuals are all the professionals who treat geriatric patients, and the group effort is the best outcome of geriatric dental treatment. Okay. So to start with, as we have heard from my colleagues before, of late there is emphasis on increased interprofessional education. Why are we doing this? Well, as said before, older population is increasing thanks to medical technology. The advance in medical technology helps us to diagnose and prevent diseases and treat very severe diseases, which has increased the life expectancy of population. Now, as this population ages, it also has other medical issues which need to be taken care of. And this gives the need for coordinated healthcare for overall holistic patient healthcare. Now, we cannot not talk about oral health when we're talking about healthcare. Oral health is a critical component of overall health. Why? Because if there is oral disease, it can impact the quality of life of patients. How do you think that would happen? Well, supposing a patient, an elderly patient, has a toothache, he may start taking very soft food, or he may start avoiding to chew from one side. Avoiding to chew from one side will cause musculature problems, or he may have other pains elsewhere on the face. His diet may be hampered to a very soft or fluid diet, which may affect his overall nutrition and eventually lead to weight loss. In case the patient has missing teeth, the patient may be very, very conscious to smile or show his teeth, or, may not even ask for treatment, thinking that, okay, he's supposedly old and losing teeth is part of aging. So we are here to tell us and discuss about what we can do to help these elderly patients. Collaboration, big word. What does this mean? It means a team which supports each other, works together as a team, communicates effectively, trusts and motivates each other to inspire each other for optimal success. In this context, our success is the best care possible for a geriatric patient in whatever settings that are available. Okay, so collaborative practice in healthcare occurs when multiple health professionals provide comprehensive services by working not only with the patients per se, but their families or carers or caregivers or the social support system that is available to that geriatric patient together to deliver the most optimal care across the settings available. Why do we do this? What are the benefits? The benefits of this kind of a collaboration is the participants who are involved, that means the professionals, achieve more as a group than they would individually. Because they are a group of professionals, they can serve and treat a larger group of people than they would be able to treat individually. And of course, when they see and treat larger groups of people, they grow on individual and organizational levels. What is the benefit to our elderly population when we have a collaborative working team? You definitely understand that it optimizes the clinical outcomes because we are delivering patient-centered care, not only medical, not only dental, but physiotherapeutic, psychological, as and whatever needed. We thus may reduce hospitalization. Reduced hospitalization may also lead to reduction in costs and other benefits. The patient is more satisfied because there is a seamless care coordination. there are reduced adverse drug reactions, and this would further lead to decreased morbidity and mortality of patients. Now, who are the members of an interprofessional geriatric patient care team? I've given a chart here, but this team is not confined to these people. These people go in and out of the team depending upon the needs of the geriatric patient. So what does the team roughly consist of? It starts with a geriatric dentist, a geriatric physician, nurse. The caregiver and the family play a very major role here because sometimes they are the people whom the patient depends on for his life, for commute to and fro to the hospital or to the area where treatment is met. Apart from that, you may need a psychologist, a nursing assistant, hygienist if permissible in your countries, a pharmacist, a physician assistant, a physical therapist, a social worker if the patient does not have family support, a dietitian, and so on and so forth. So what do these people do? They work together, they define each person's role. That means everybody in the team respects and has a definite role to play. They work together through good communication. How? So how do they work together? First and foremost, they discuss each case. That means each symptom, each history is discussed in detail. And each specialist or professional provides their thought process on how the treatment should be for their particular discipline. Interdisciplinary and evidence-based treatment is met out through collaborative discussions and good communication. The records are very thorough. Everybody knows what's going on. And most importantly, as the patient's family is part of this team, they know the importance of each treatment and each professional. But there should be some core competencies and characteristics of the interprofessional team, which they should all respect for a team to work together seamlessly. Now, what are these competencies? To start with, values and ethics for interprofessional practice. Now, we already have the patient and the family as partners in our team practice. We need to respect and value each member of the team, and we need to know that our goal is patient-centered care. And as from the point of a geriatric oral health, it is the role of a dental dentist to educate all professionals on the importance of dental care for patients of different ages and how it may impact other organs of the body. Okay. Coming to roles and responsibilities, all members of the team should understand the skill set and respect them of other professions. We should also engage diverse professions as needed for the patient's health. Cross-referrals should be done between dental and non-dental providers, and interprofessional education should be carried out at all levels where each professional understands the role of the other professions. Communication. Communication is one of the key factors. So communication should be frequent, clear, and effective. So all members need to know what is the treatment plan, why this treatment plan has been selected over the other options. It has to be discussed with the patient's caregivers, and we could use various communication tools like teleconferences to ensure that all members of the team are aware of the latest changes, if any, in the treatment plan. Coming to team and teamwork, all members need to cooperate, and we need to jointly develop a comprehensive care plan and educate all members about the necessity of other disciplines. Sometimes, if a patient is homebound or he may be not very easily mobile, we may have to consider about providing dental care in a non-dental setting like a hospital or a home where the dentist may have to make a visit sometimes. So these are roughly the characteristics that make up a good interprofessional team. Coming to interprofessional education, this is an approach where all the professionals learn about the other professions from each other, along with each other, to improve the collaboration and quality of treatment for a geriatric patient. What are the basic principles of this? Respect, responsibility, effective communication, and a collective effort. Why do we do this? Why do we need these principles? We need this so that we have a very strong team. We know our communication is good and clear. We all act as professionals and do what we need to do. We have confidence in each other and respect for a multidisciplinary approach. But why are we talking about this for the dental care per se? It's for one simple reason, that the oral cavity is a mirror of the health of the rest of the body. And most of the diseases are reflected in the mouth first. So we should never ignore the part that dentists can play in diagnosing a disease and catching a symptom. Is it easy? No. There are challenges. There are challenges which can present to you for running an interprofessional practice. And what are these challenges? Firstly, lack of funding opportunities. Gathering equal representation across all disciplines means having a representative for a psychologist or for a physiotherapist may be difficult. Then the difference in status of different disciplines. Sometimes, the doctors may feel that they need to be heard first, or the physiotherapists may feel that, they are not being given enough attention. So this may cause a bit of friction between the teams. Crowded health professional curricula. We may be too busy teaching or have our schedules full to be able to contribute to interprofessional experiences. Shortage of qualified faculty and faculty incentives, logistics with scheduling and transport, lack of funding opportunities, obviously. However, for every dark cloud, we try to see the silver lining. And let us talk about now the possibilities where we could engage in interprofessional education. So firstly, we could increase our attendance in interprofessional education experiences in clinics. So when we see that a case is being discussed by 2 or 3 professionals, probably we could learn something from them or give the input of our profession, whatever little bit it may be. We need to firstly strongly identify with our medical knowledge of the body, which may be clinically relevant and how it presents in the mouth. It is very important to convert our dental records into overall cross-professional electronic reports. So if you don't only have that the patient came for a filling, but you also have the record that, okay, he has been going to the primary healthcare provider and he has high BP, he's on this medication, and the last checkup was done on so-and-so age, and these are the do's and don'ts provided by the doctor. Whom does he come with? Does he need physiotherapy for anything? Does he have any familial history? All these records should be put together. We should stress on effective communication skills, and we should try and engage in highly functioning healthcare teams to get an experience of how they work together. Why should we do this? How does it benefit me? Well, studies have shown that professionals who have been a part of interprofessional collaborations come out to be amicable, courteous, good communicators, good at critical analysis, respectful towards their fellow healthcare professionals because they understand the roles that they can play, sensitive to the collective responsibility in the team, where everyone acknowledges each other and they all know they win or lose together. So whether it's a positive outcome, they all share the credit. If it's a negative outcome, they all share the loss. And not only does it instill more confidence, but it also changes their attitude towards patient treatment per se. So let's consider a case. So in came an 84-year-old homebound man with a medical history significant for chronic kidney disease, hypertension, vision impairment, depression, and recent weight loss. He came for a medical checkup and was referred for comprehensive oral evaluation during his hospital visit. Why? Because he had a broken denture and this was contributing to his weight loss. It was also documented in his records that there were periods when the patient was argumentative and he was depressed. So the initial oral health assessment found the patient was wearing ill-fitting dentures. Now they formed a team. The team consists of a dentist, a primary healthcare provider, 2 dental students, and of course the patient and his wife. A treatment plan was discussed and this was agreed to by the patient and his wife. The patient and his wife were explained in front of the entire team about what are the steps in fabrication of a denture, what would be done in each appointment, how long would the appointment last, and if there were any do's and don'ts to be followed. The team did take concern of the note that he was depressed and that he was losing weight because of poor eating. So what did they do? On the first day of the visit, the dental team came in early and they waited for him while he had his breakfast in the hospital. And they were there to experience all the problems he had, all the foods that he selected and why he selected soft food, and where was he having pain while he was chewing with his ill-fitting dentures. Once the patient was ready, the students then went in and took the time to develop a rapport with the patient. They asked him, what did he do when he was young? How many children he had? What did he do for a living? And where were his children now? Whether he had grandkids? What were his hobbies? And they found out that he was a retired choir director. When they came to know that, they realized that probably this man is fond of music and they could incorporate it into his appointments. So they offered him that he could select the kind of music that was played during his dental appointments. Not only that, they also promised him that since fabrication of a denture needs a few appointments, the day the denture was done, and if he was happy with it, we would have a concert for him. That means they would sing for him at the last appointment. This made the patient very happy, and he started looking forward to dental treatment appointments. He changed the way he would appear for those dental appointments. From looking very disinterested in life, he started dressing up for them. He started wearing a shirt and a tie to come for these appointments because he knew that he would listen to his favorite music, and for all you know, there would be singing. So on the last day of his appointment, the patient actually got his own violin and he played the violin while the students sang for him. All done, denture delivered, the dental team left, and the patient continued his medical appointments. Now, what happened on the next appointment when the denture was delivered, the review was done, and he went for his normal general medical checkup? 6 months after the completion of the case, on a follow-up by the primary care provider, it was reported that the patient has gained weight and was now actively engaging in social situations. Now, how much has he changed from the man they met 6 months earlier, who was argumentative and depressed? What did this magic? A simple rapport that they developed with this patient for maybe a few minutes by asking him about his previous life experiences. So my friends, it's something so simple that can get you a very effective treatment outcome. And trust me, patient satisfaction is one thing that makes all professionals very, very happy. So to summarize my talk, I would just leave you with 3 important points. Functional and cognitive impairments in geriatric patients require us to involve the family members and caregivers into the geriatric treatment team. We need to have very effective and good communication with each other so that we have the most optimal treatment delivered to the patient. We need to collaborate together with other health providers, and we need to ensure that our professional identity is not what is the center of this thing. You have to remember that the team treatment plan is more important than what your treatment plan may be. So it's a team decision. And why? It's for the best of the patient. With that, I'd like to say a big thank you for your patient hearing.
Thank you, Dr. Kirti, for the important and interesting presentation about interprofessional collaboration in geriatric dental health. It's so interesting to see how much impact the interprofession collaboration can have on a patient's health and even well-being, mentally and physically. Thank you for this inspiring talk. And we would like to invite our participants for question. So we can have maximum or around 20 minutes of question and answer. First, I would like to give the opportunity to our participants. If you have any questions, please feel free to put it in the chat or to raise your hand or to open your mic and then ask the question. Otherwise, I will be maybe the lucky first one to ask you questions. It's really interesting to listen all of your talks on how two of the important things, empathy and also interprofession education, can have impact on geriatric dentistry. I was curious in your university hospital setting, or even in Malaysia, or based on your experience or even what you observe, how does the system actually provides room for holistic geriatric dentistry treatment, and also room for empathy and also interprofession education?
I think Dr. Naveen can start.
Yeah, Miss Agnes, thanks for the question. It's a very nice question, actually. As clinician as well as the academicians, in IMU, we have integrated teaching process. Okay, so integrated teaching process means that all multidisciplinary specialists come together on the floor and they supervise students group wise. So, for example, we divide the students in 4 groups in the clinical practice. So each group has been allocated one prosthodontist, one endodontist, one periodontist, like that, one orthodontist, or any other specialty respectively. So one patient is getting the attention, or the student is getting the attention of all the people together. So this is one way of integrated approach. This is just the beginning, though we do not have as present the medical students or the medical healthcare professionals involved in that thing, but definitely nursing staff is definitely involved in the clinical process throughout the treatment process. And they do assist. We have the medical emergency unit at the call, which is well available. Emergency services are available at the phone call, and even at the few specific healthcare personnel are appointed for that thing. Apart from that, we have the special arrangements for the geriatric, like wheelchair arrangement, the slanting slopes are available where this patient can be transported from one floor to another, and especially those who are disabled. So such kind of arrangements we do have. Some simultaneously we have the medical health center right attached to us, our oral health center. So in case of emergency, we do call the patients, but dedicated as of now, if on record I say, we do not perfectly have the dedicated setup for the geriatric dental health care in an ideal interprofessional education system, but we propose and we plan to execute this thing in the coming future.
Okay, empathy. I mean, we talked about empathy. Probably in our curriculum, it's one of the prime, teaching or education philosophy, you can say. So we have a dedicated module for that for the dental students. It's called Clinical Humanities and Well-being. So this module, it's a very interesting module. It has got a lot of attributes from from semester 1 until semester 10. So it's not, even the final year students, almost at the end of their studies, they do have this module where empathy and communication is taken care. And we have dedicated workshops, workshops in the sense where supervisors will group with the team of students, and there will be case scenarios and discussions on that. So I think Surprisingly, today morning I had a workshop. So I was talking about this empathy as well. So one of the attributes in that communication workshop is how to, effectively deliver the empathy, or how to showcase your empathetic behaviors, things like that. So so it's ingrained, it cannot be a one-off event like you do one time, and it has to be along the process, along the continuum, so that they carry these principles forward. That's what I can see in the survey. They're quite very familiar in the process. Except that, as I told, like probably we need to have a little bit of close one-to-one interview approach where we can understand their emotions or what they really think about. And if it comes as an open, open answers, probably we could analyze better what we see the differences. Some of the students have different perspective of these empathies. Obviously, if there was no question on the difference between sympathy and empathy, so if that question arises, probably we'll have different versions again. So it's as I told, it's a soft skill, softer than the soft skill. Probably we need to ingrain that probably. And I think Dr. Kirti can explain about the interprofessional collaboration in our system.
Thanks, Dr. Siva. For interprofessional collaboration, like Dr. Naveen mentioned, we do have all specialists on the floor. So when the geriatric patient comes in, firstly, we start from access. We make sure that his access is easy. So we have ramps for wheelchair if the patient needs assistance. We have some extra DSAs who can help the patient with their wheelchair and get them food or water or whatever is required. Also, we have all specialists at the same time available in the clinic, along with medical facilities if need be. So for now, that is roughly how we form integrated practice for the geriatric patients. Apart from that, like Dr. Siva had mentioned, we teach our students from grassroots levels. That means from SEM 1, they are learning about empathy and how to manage patients, how to manage anxiety. So even though they haven't really seen patients, they're already learning about these things. So by the time they come into clinics, they already know of how to manage these kind of patients. That's from me. Thank you. If there's anything else? I see a question in the chat. What are patients' family responsibility in improving geriatric? Should I take it? Okay. So thank you for your question, Mr. Ahmad. And coming to my talk, which was on the interprofessional team. And yes, the family has a responsibility to play because it all depends upon the geriatric patient and how elderly is the patient. Right? Sometimes they may have mobility issues. Okay. Sometimes they may have issues about financial issues. So probably the family plays a role in deciding the final treatment plan because yes, the costs are involved. Sometimes the patient may have dementia. So they may forget whether they've brushed or not, whether they've had water or not. So probably the family has to get involved in keeping a track of the patient's dentures, in reminding the patient to maintain their oral hygiene. Like, just checking on your mother whether she's brushed, like it's such a role reversal, right? From the way we've learned it. But these kind of things are where family plays a role. The family has to be able to get the patient to the clinic to undergo treatment, right? So if the family is not on board in the interprofessional team, we are all at loss. So that's how I would say that family is responsible in geriatric dentistry. I hope I've answered your question. Thank you.
Thank you for the answer, Dr. Kirti. And we'll give the opportunity to our participant, Wahyu Sulistiarini.
Hello, good afternoon. Thank you very much for this chance. Actually, my question is related with previous question, and I'm so glad to learn with the speaker today because basically I'm a nurse, but I learned many things about dentistry now. So in clinical situation, mostly people think that oral health is often not the center of the problems. Yeah, especially in a aging population, in elderly population. mostly they focus on the disease or maybe the comorbidity appearance or symptom appearance. So when they go to hospital because of their disease, but in fake, maybe according to the elderly perspective, maybe they have some uncomfortability because of the change of appearance, maybe loss of teeth and other problems. Maybe they think that this is a big problem, but in Indonesia, most of people feel unwilling to relieve that problems. It's kind of uncommon problem, but because the other people thinks that, oh, it's elderly, it's usual and common that they lose the teeth and they have several problems because of their body, so they think that it's a usual and common problem. So how, I think it's kind of like ethical issue also, how to bridging that problem. Maybe we have different perspective. Patient feel that it is a big problem because of different appearance, changing appearance. They feel like their quality of life decrease because of that. They feel shy because of different appearance, but the other people think that, oh, it's common. So how to bridging that problem and how to encourage and improve the awareness of family that this is also a problem of for oral health. Yeah, maybe this is my question. Thank you.
You are still muted, doctor.
Sorry, yeah. So I think very interesting question. And as you rightly noted, Mr. Sulistiareni, yeah. So the awareness, right? The awareness, I think what Dr. Kitty and Dr. Navid mentioned, the patients who are coming to our clinic, right? Where there's a setup. But we also go for community works, the social works, where we see a lot of urban poor and older people. And that's totally a different, group of strata of people who whom we are actually intervening, right? So sometimes we do bring them to our facility and give the care. So that's the purpose. We go for screening and we bring them. So in that process, probably when you ask even for the elderly, right? It's not the family alone. The elderly also sometimes, what is the importance of having this? I don't need that, kind of teeth, I'm just old and things like that. But sometimes we forget it's a process which is something very much taken for granted, as I noted earlier, and that dignity or the independence is not given because they are slightly on their phase of life where there is not much activity and somebody else has taken, the man of the house is no more a man of the house sometimes, so the another person has taken over. So in that process, they might lose that, connection sometimes, right? So they themselves, or even the children who take care of their parents, older parents, we can see that. And I mean, we need to be very honest here, right? Sometimes we think, okay, they are old people, they can do only this much. And I mean, I don't think so. Like they need a, implant or the sophisticated dentures. It could be a simple denture they would do. So that importance is not happening, right? So that is a very important, like empathy, probably these habits needs to be inculcated from the younger generation. Unless we teach our kids, I don't think, I don't know whether our parents actually taught us about this or we lack in that aspects. But at least at this point in time, when we look for social responsibility and, the community responsibility as well as togetherness, probably one thing we can solve this issue. One is awareness platform. You can actually, when we go for camps or community services, some of the important things we can tell to the masses, especially people who are in the below the social divide, right? They need to know that, okay, it's cannot be taken for granted. Their dignity needs to be valued and they need to be given that independence to their thoughts and activities. So this is one awareness and educating our students as well as our own offsprings. Maybe the future can be better as well, mostly. Anything? Yeah, yeah.
I'd like to add that sometimes dentistry is considered as a very expensive treatment to get, which is the most thing that deters people from coming to the dentist. So apart from the awareness of importance of dentistry, it should also be stressed on that because there are no teeth, because the patient's lost teeth, he's not able to eat properly. Okay, not able to eat properly, weight loss. Weight loss, poor health. Okay, so this sequelae should be explained. Number one, awareness, like Dr. Siva said. Number two, we should also teach the patient and his family that dentistry does not always have to be very expensive. For missing teeth, you don't need an implant. You don't need a bridge. You can do something like a denture, which is the cheapest. You can do it in one of the community settings, or you can do it in a university where students do it for the very minimal prices. So it does not have to be very expensive. Is another thing that can be explained to the family of such patients. Thank you. Nabi, anything?
Yeah, I would just like to add few points, like especially as Dr. Siva mentioned, that community awareness and stressing about the awareness, why awareness is important. At IMU, we do have a common awareness platform, which we call it as IMU Care. Okay, so the beauty of the IMU Care is it inculcates the interprofessional care actually. Here, it's not necessary that only dental person is going into particular awareness week or the campaign. There may be any medical person, there may be any psychologist, there may be a nutritionist. So it's a compulsory thing for staff, which is a mandatory for the staff. So such kind of thing not only gives the benefit to the patient, but also it builds an interprofessional team. And as a dentist, if I mention that patient will come to us at last. First, they reach the primary healthcare like medical professionals or maybe some other support staff like nursing staff or so. So if we all are working as a team, so we know each other. Okay, this problem has occurred from X problem, from X situation. So probably nursing staff already knows, oh, doctor, this may be because of the dental health issues. It may not be primarily originated for the medical health. So this becomes a team. Again, it's a beautiful team effort. So not only at the treatment level, even at the society level, we have the structure under the banner of IMU Care that we deliver team-based collaboration.
Thank you for the explanation.
Thank you for the nice explanation. And do we still have questions? Maybe there is still room for one quick question. Or otherwise, if all questions are already answered, please allow me to provide some take-home messages. It's interesting to hear from all our speakers how geriatric dentistry faces unique challenges that can create ethical as well as clinical challenges in caring for geriatric patients. Some of the challenges already mentioned are expensive treatment, transportation, the accessibility, the changes in the physical and mental condition, and then there are also communication barriers. And as we know from the Malaysian as well as from the Indonesian settings, there are also beliefs and myths. And we have also already get inspiring knowledge that empathy is one of the important aspects to mitigate these challenges. And it is not one stop or one of effort to do empathy, but as we can learn from the IMU, it is like a longitudinal learning or a whole learning from the first semester until the end of semester from the dental students, and also shown through community work and then in the interprofessional education. So it's an ongoing effort. And then we have also seen how the interprofessional collaboration in treating geriatric patients also resulted in such a significant well-being, not only for the oral health, but also for the general well-being of the geriatric patient. From some example of the beautiful cases examples. So I think we are very lucky, and we have many things to take home after this from our distinguished speakers. Thank you once again for Dr. Naveen, Dr. Siva Kumar, and Dr. Kirti. Thank you for this important and very beautiful opportunity for us from the Center for Bioethics and Medical Humanities, from the UNESCO Chair for Bioethics for this opportunity. And I hope we can see you again in another meeting or collaboration. Thank you so much.
Yeah. Thank you.
so much.
Thank you.
Thank you.
Thank you so much.
Thanks for your
Agnes.
thoughts.
Thank you so much.
Thank you.
Thank you, Doctor.
Thank you.
I will ask permission to leave. Thank you so much.
Bye-bye.
Bye.
Thank you. Bye-bye.